Hello, everybody, and thank you so much for joining this informational webinar about our 2026 Spring Funding Opportunity from the Kaiser Permanente Center for Gun Violence Research and Education, powered by the HAVI, the Health Alliance for Violence Intervention. Please note that this webinar is being recorded and will be made available on the Funding Opportunities section of our website for future reference. My name is Dr. Melissa Mercado, and I serve as Senior Director of this center. And I want to tell you a little bit about the center. In 2023, Kaiser Permanente invested a landmark $25 million over 5 years to fund this Center for Gun Violence Research and Education. This is part of its long-standing commitment to help communities prevent, treat, heal from firearm-related injuries or death. Kaiser Permanente is collaborating with the Health Alliance for Violence Intervention, the HAVI, to coordinate the center's efforts to innovate and scale effective community-led solutions to firearm violence, rooted in healthcare, care delivery, and clinical interventions. As such, we fund research to test and expand those health interventions that treat and prevent firearm injuries and deaths, as we seek to do with this 2026 spring funding opportunity. Thank you for your interest and commitment to firearm injury prevention and for joining us today. Next slide, please. Before we begin, a few important considerations. During the webinar, please submit all your questions through the Q&A module at the bottom of the Zoom screen. After the webinar, if you have any additional questions, please feel free to ask. You can do so via our website, on our Contact Us section, also on the left column of the Funding Opportunities webpage. A frequently asked questions or FAQs document is also available online and may be updated with additional questions and answers. We will notify all webinar registrants of any updates to that FAQs document. This webinar, as I mentioned, is being recorded, and the recording will be posted on our website for future reference. Next slide, please. During this session, we will go over the vision and mission of our center, present an overview of this funding opportunity, its purpose, the eligibility criteria for it, the application process and timeline. We will also spend some time discussing the letter of intent, which is a core component of the initial stage in this two-stage application process. We'll present the selection criteria by which eligible applications will be reviewed and discuss some application process best practices for your benefit. After that, we will have time for live questions. Next slide. As we know, gun violence is a leading cause of premature death in the United States. It is claiming more than 45,000 lives each year, and it is the leading cause of death among children and teens, according to the Centers for Disease Control and Prevention. The Kaiser Permanente Center for Gun Violence Research and Education is focused on building a public health response to this epidemic grounded in equity. Together, in collaboration with the HAVI, the center endeavors to transform the firearm violence research and education field, pursuing a world that is free from firearm violence, where the communities are the ones that lead the way, driving the meaningful change that is needed for a healthy and safe society. Next slide, please. And we do this through three main mechanisms. First, partnering with communities disproportionately impacted by gun violence, by uniting that rigorous scientific research, scientific discovery with community-led approaches, and through funding research and education initiatives that empower communities most impacted by firearm violence. Next slide. Since 2022, the center has prioritized grant making, particularly for research, capacity building for research, narrative change and education, and sponsorships and alliances. Since 2022, over $8.5 million have been awarded to 49 grantees across 25 states and the District of Columbia. That is all U.S. regions minus the territories. Next slide. And on May 4th of 2026, the center released its 2026 Spring Funding Opportunity. This funding opportunity seeks to support research on firearm violence or firearm suicide prevention, particularly in two areas: to build a capacity within organizations to conduct research on healthcare approaches, and to expand or initiate new research through pilot or formative healthcare research. Each award will be for 2 years, with amounts varying by category area. Let's take a closer look at this. Next slide. The first category is focused on research capacity building. with the goal of building capacity within the organization, institution, and/or clinical care setting to conduct research on healthcare approaches to addressing firearm violence or firearm suicide. There will be 2 projects funded up to $100,000 each over 2 years. Some examples of this type of projects include early stage research exploration or research plan development, partnership building between healthcare institutions, community-based organizations, academia, and building that research infrastructure that is needed alongside program expansion. Next slide, please. The second category is focused on pilot or formative healthcare research. The goal for this one is to expand or pilot new research on evidence-informed healthcare practice or clinical care models that address firearm violence or firearm suicide. Up to 2 projects will be funded, up to $250,000 for each over 2 years. Some example of projects that could be funded through this category include needs processes and/or implementation assessments, exploratory, descriptive, or explanatory research, and research that advances our understanding of risk, protection, underlying mechanisms, or outcomes with an emphasis on practical translation and dissemination. Next slide. This 2026 spring funding opportunity is focused on healthcare, defined broadly. Healthcare settings include hospitals, federal qualified healthcare centers, or other community-based organizations. Healthcare approaches may or may not happen solely within clinical settings. And specifically, this funding opportunity seeks to support research that advances evidence on effective strategies to reduce firearm violence or firearm suicide across communities in a range of healthcare settings, knowledge about effective strategies to identify individuals at increased risk of firearm violence or firearm suicide within healthcare settings, and healthcare approaches to reduce harms and prevent future risks of firearm injury following those incidents of violence or suicide attempts. Next slide, please. We know there is an urgent need to prevent community firearm violence and firearm suicide, and as such, it is critical that the most impacted communities inform and lead the development of effective solutions. Through this funding opportunity, priority will be given to initiatives that work directly with communities or that are led by individuals most impacted by firearm community violence or firearm suicide. We will also prioritize them and those initiatives that demonstrate how an impacted community is meaningfully engaged in the leadership, in the design, implementation, and/or evaluation of the projects, as well as those that work with communities that are historically excluded from conducting research activities. Next slide. This call is open to applicants at varying stages of the research continuum. Eligible applicants include individual researchers that are employed by a 501c3 organization, nonprofit 501c3 organizations, including community-based organizations, faith-based institutions, academic institutions, hospitals, FQHCs, and other community health centers, and groups with a 501c3 fiscal sponsor. It also includes, as for eligible, quasi-governmental organizations, state, territorial, and local government agencies within the United States, Native American tribal organizations, and Native American tribal governments. Previously and currently funded awardees in good standing are eligible to competitively apply for this funding opportunity, provided that they have completed all the required deliverables from prior award cycles or are demonstrably on track to do so at the time of the award to start. Individuals and entities that are not eligible include employees and researchers at Kaiser Permanente, those that are affiliated or that are researchers at the Kaiser Permanente Bernard J. Tyson School of Medicine, and currently funded awardees who have not or are not demonstrably expected to have completed all required deliverables by January 1st of 2027. Next slide, please. Of note, we encourage applications from early career researchers. These are defined as new and emerging researchers who are early in their dependent research careers who have not yet secured substantial external funding. It can include investigators who are within 5 to 10 years of completing their terminal degree, within 5 to 7 years of a first faculty or independent research appointment, or who have not previously held such a large competitive peer-reviewed award as a principal investigator. We also encourage applications for community-based organizations, defined as nonprofit or mission-driven organizations. This includes faith-based organizations that are rooted in or primarily serve a specific community or population. Please note that an individual may serve as a principal investigator or co-principal investigator on only one application. However, individuals may be listed as collaborators or key personnel on up to 2 additional applications if the projects are clearly different and do not substantially overlap in scope, goals, or time commitment and effort. Also, please note that applicants can submit no more than 2 applications per funding period. Institutions with large or complex structures can have multiple applicants who are defined as distinct campuses, distinct centers, divisions, or affiliated entities with its own leadership and operations, or with a distinct office of sponsored research. For example, separate colleges within a larger university are considered distinct entities, as are schools or departments within the same institution, or distinct units within large organizations with separate leadership and operations. Next slide, please. Kaiser Permanente Center for Gun Violence Research and Education, as previously mentioned, will follow the 2-stage application process for this 2026 spring funding opportunity. The first stage is what includes the letter of intent. Applicants first submit a letter of intent. It is referred to on the online application system as the initial stage. All eligible letters of intent will be reviewed, and we ask you to please refer to section 2 on the guidelines online for more information. Then there will be an invitation-only full proposal stage. Selected applicants will be invited to submit a full proposal. This is on the section 3 of the full guidelines online. Now, before starting the application, we encourage everyone to please read those guidelines that are online on our website. Read them fully, and also read the frequently asked questions documents, which, as I mentioned, will be updated after today's webinar. Next slide, please. Here is the timeline for our 2026 spring funding opportunity. It launched on May 4th. Programmatic questions will be received and addressed through June 3rd at noon Eastern Time, 9 a.m. Pacific. Only technical questions, that is, related to the application system or the process, will be addressed after that time and through the submission deadline for the letter of intent. The letter of intent and all associated application materials are due on June 5th at 12 Eastern Time, 9 a.m. Pacific. These will be reviewed through, and all applicants will be notified of their status by July 29th. At that time, applicants that are invited to submit full proposals will also be notified, and guidance for that process will be shared with them. Invited full proposals will be due on September 1st. Only invite applications will be accepted and reviewed by a panel of experts. The selections will be made in early December and subsequently announced. Next slide, please. Now, we're in the initial stage of the application process, right? And one of the main components of this initial stage is the letter of intent. The purpose of the letter of intent is to help the center better understand the scope, the focus, and the diversity of the projects that are under consideration, support the inclusive review planning, and identify opportunities to provide early guidance or connections where appropriate. This initial stage process is intended to support early engagement, to reduce barriers to entry, and encourage promising ideas at all stages of development. The letters of intent should not be more than 2 pages long and should include the following as listed on the screen. A project overview, which is a brief description of the project, including the problem statement, background, significance, the proposed approach or intervention and setting, the type or types of firearm-related violence that are being addressed by the project, alignment and public health significance, and the readiness for this project to be conducted. It should also include a description of the community or population most impacted by firearm violence or firearm suicide that the project seeks to serve, and a summary of how community will be meaningfully engaged in the leadership, design, implementation, and evaluation of the work. The letter should also identify key partners or collaborators and their anticipated roles, if applicable, and a brief statement of the intended contribution to advancing healthcare-focused firearm violence or suicide prevention, mitigation, or survivor care, with attention to health impacts, the anticipated outcomes of impact. It could include references, if applicable, as well. The letters of intent are due June 5th. Let me restate that at 12 p.m. Eastern Time, 9 a.m. Pacific Time via the online submission system. Applicants will be notified of the receipt of their letter of intent and the initial stage applications by Health Resources in Action, HRIA, which is the fiscal agent for the center. The submission of a letter of intent does not guarantee feedback nor an invitation to apply for the full stage. While some applicants may be asked for clarifying questions, responding to these does not guarantee an invitation to submit a full proposal either. Based on the letters of intent review, only select applicants will be invited to submit full proposals. Next slide, please. These are very highly competitive awards, and as such, it is critical for all potential applicants to carefully review the selection criteria, and we've summarized them here on this screen. First, significance and impact. Your letter of intent, your application is going to be evaluated to see if the proposed work is original, creative, impactful. It should address a significant in healthcare-focused firearm violence or firearm suicide prevention and mitigation, and should answer the question of would it result in generalizable outcomes that are important and relevant for healthcare systems or for community settings beyond those of the understudy. It will also be evaluated in terms of community engagement, as previously noted, the meaningful involvement of the community in leadership, design, implementation, completion, and dissemination of the project findings. It will be evaluated in terms of the feasibility and team capacity for the project. The project that you describe on that letter of intent and that application should be feasible completed based on the scope of activities and the project team's collective experience and expertise. Collaboration and partnerships. The letter of intent will be evaluated to see if the collaborative partnerships proposed are logical and equitable, with beneficial outcomes for all team members, and with the roles and responsibilities clearly outlined. There are also some category-specific criteria for the Category 1 applications, those that are focused on research and capacity building, and for those that are for pilot and formative healthcare research, Category 2. We encourage you again to review the guidelines for those specific review and selection criteria. Next slide, please. There are a couple of application process best practices that we would like to share or put in your radar. Common pitfalls to avoid, and these are some of the frequent reasons proposals are not advanced. Problem method misalignment, when the application does not show a clear link between the need and the proposed approach. Another one is limited community engagement. There is community engagement mentioned, but it's not meaningful or it appears to be a superficial involvement. There could also be weak equity integration in the application. Equity is not embedded in the design, or the implementation is only mentioned. That would be a common pitfall to avoid. Underpowered sample sizes that are not adequate to support the conclusions that you expect from the project. Having an unrealistic budget or misaligned with scope or deliverables, and gaps in the topic expertise among the team members. Next slide. Those are pitfalls, but there's also some tips that we would like to share. Tell your story. Tell us your story and tell us why is this meaningful? Why is this important? Supported with the data and the information that is requested in the guidelines. Ensure that the submission reflects project goals aligned with this funding opportunity. Share and demonstrate for your capacity and the credibility of the team. And answer the question being asked. I put there, not the one you wish you were asked. This funding opportunity is very specific, and we have so many different other ideas and worthy projects that need funding. In order for your application to move forward, it needs to be forward to review. It needs to be aligned with the scope of the funding opportunity. And please carefully copy, edit, and proofread your submission before sending it in. I would like now to pass it on to my colleague, Lindsay Williams from HRIA. She will talk to you briefly about the application submission system. Lindsay.
Thank you, Melissa. We can advance to the next slide, please. So, as Melissa said, my name is Lindsay Williams. I'm the Associate Director of Grant Making Operations at Health Resources in Action. We are happy to support the grant making process on behalf of Javi and the center. So, here is a screenshot you'll see of what the front page of our grant submission system looks like. And it also lists for you the URL where you can access the system. The system is also called Smart Simple, that is the software vendor that supports the system. And then I've also provided here the technical assistance email, which is grants@hria.org. So if you are running into any technical problems while you are working inside of the system, you can email that grants@hria.org address, and that forwards right to myself and my team, and we'll get in touch with you as soon as possible. Next slide, please. Really, all I wanted to feature today is a particularly tricky thing and that our system has, which is really neat, but also does cause some questions sometimes. So this particular grant application system has a section called the invitations feature, which will allow you to invite others to work on the application with you. You may add collaborators, including support staff or grant writers who are helping you with the proposal. Please note that collaborators will be able to edit your application, but they will not be able to submit it. However, you are not required to give collaborators access to work on the proposal in the system with you. So it is an option, but you are not required to do so. Please also note, if you are applying on behalf of a hospital-based or university system, that you will be required to add one authorized institutional representative to your application using this module inside of the system. This AIR, Authorized Institutional Representative, is typically an individual responsible for research oversight. They often work in the Office of Sponsored Programs or the Development Office. This person needs to certify the application before you submit to ensure that the applicant and the institution agree that they have met eligibility requirements. I also want to note that applicants from community-based organizations, tribal organizations, governmental organizations do not need to invite this role to the application, nor will they need to do the certification process. So this is truly just for the hospital and university systems. I also want to note that there is a common error that we see when you use the invitations module to invite folks to work on your application with you. Only one individual may work on an application at any given time. So if you happen to be trying to access your application and you get a checkout record there on the bottom of the slide there, it will say this record has been checked out by name, date, and time. So that's going to necessitate that you communicate with the folks you have invited to work on your application with you. You'll have to email them, ping them separately, and let them know that you are trying to get access to that record. You can figure that out amongst yourselves, but we definitely want to highlight that this is especially important around that time of application deadline. And we do see that come up. So people will email as the application deadline is approaching in the next couple of hours, and they want to know, why am I locked out? So it's typically because someone on the application team is actually inside of the record and they need to log out so you can submit. So those are really just the main points I wanted to highlight. Happy to take questions about the system overall, but I will go ahead and hand it back to Melissa. Thank you.
Thank you so much, Lindsay. And it's good to know that ahead of time, right? So we can address it. And of course, if there's any questions along the way, we have provided the information on how to reach us and how to reach the grants team. Thank you. Next slide, please. Right. So as previously mentioned, the letters of intent, that initial stage application, those are due on June 5th. The letter of intent status notification will occur by July 29, at which time those that are invited for full application submission will also be notified. The online guidelines document, it's on our website, and it includes a brief summary of what to expect for that invitation only full proposal stage, so you can start getting a sneak peek. Thank you so much for being here. Just the fact that we have as many people here on the line, it's amazing to see. That means you're interested, you're committed to community violence and suicide prevention, firearm community violence and suicide prevention. We appreciate what you do. Thank you for who you are, for what you do, for your commitment to solving this epidemic, because violence can be prevented. We look forward to hearing from you. Remember, letters of intent are due on June 5th. And here is our email address if you have any additional questions or follow-ups, as well as our contact us form on the website. We are here to support you. Have a good day. Thank you.